In the world of medicine, every second can mean the difference between life and death. But what happens when the doctor can't reach a patient in time? What if a life saving procedure needs to be performed in a remote area, a disaster zone, or even in a battlefield? Introducing the Flying Surgeon, an innovative drone designed to perform small surgical operations in emergency situations. After coming up with the idea, we started working on a rough CAD model to visualize how the flying surgeon could function. This model gives a glimpse of how the drone would be designed. With a compact body for stable flight and two robotic arms will be attached underneath for performing medical tasks. In these concept visuals, you can see how the robotic arms are positioned to allow precise movements. The idea is that they would be capable of handling small surgical procedures such as suturing wounds or making controlled incisions even in the environments where human doctors can't reach in time. While this is still an early stage concept, the goal is to develop a system where the doctor can remotely control the drone, enabling life-saving medical interventions in emergency situations. So, how would the flying surgeon actually work in a real-world scenario? The idea is simple. In an emergency, when reaching the patient quickly is difficult, such as a disaster zone, a remote area, or a battlefield, the drone would be deployed to perform small but critical medical procedures. The drone would be controlled remotely by a doctor or a trained operator. Using a live video feed and precise robotic arm, the doctor could perform procedures like suturing wounds, stopping bleeding, or making controlled incisions, helping stabilize the patient before they can be transported to a hospital. The flying surgeon could be equipped with specialized tools depending on the situation, such as suturing needles, small surgical blades, or even adhesive medical patches. The goal is to provide immediate assistance, increasing the chance of survival for patients in life-threatening conditions. Although this is still a conceptual design, advancement in robotics and AI are making such technology more possible every day. In the future, drones like the flying surgeon could become a crucial part of emergency medical response teams. The flying surgeon isn't just an idea for the future, it's a concept that could transform emergency medical care in many different situations. Imagine a battlefield where a soldier is critically injured, but medical teams can't reach him in time. A drone like the flying surgeon could be deployed immediately, providing life saving treatment until help arrives. Or think about natural disasters, earthquakes, flood, or collapsed buildings, where victims are trapped in places incapable to ambulances. Instead of waiting for rescuers to clear debris, the flying surgeon could enter tight spaces and perform small but crucial medical procedures. Even in remote villages or isolated environments where doctors are not available, this technology could be a game changer, providing essential care where human medical professionals can't be present. Looking ahead, the potential of the technology is vast. With advancement in AI, robotic precision, and real-time remote operations, drones like the flying surgeon could one day perform more complex surgeries, assist in telemedicine, and become a standard part of emergency response team.